Technology, when sufficiently advanced, is indistinguishable from magic. As late as 2013, we were still completely on paper. So that was our next project.
When we were looking at a new EMR, physician documentation was a really important piece. I mean, especially in an outpatient environment, it has to be quick and fast and not get in the way of patient care.
One of the biggest challenges is the provider documentation. All of their documentation was essentially through dictation and a third-party transcription. We knew that for quality, for improving care, for population health, for chronic disease management, data is key. And if we do not take the right steps upfront, we will not be able to do that.
We were very focused on how many minutes every single visit took and cutting out unnecessary minutes during the outpatient stay. So when we saw Quippe, we thought, here's a product not only will get us very structured data, but also a product that's very, very quick and appealing to use.
Your goal is not just going from paper to electronic, but why do you go electronic is to capture all that data. So I was not looking for large amounts of blobs of text or something that we could not harness. I wanted to be able to really take all that granular data, pick out the quality elements and give it back to the physician. So like I said, there were lots of requirements and I wanted all of them to be met. What we sold to our both leadership team, our CEOs, our physicians, that every click that the physicians do in completing the record, we wanted it to be its worth its weight in gold. We took off and started our ambulatory journey with the outside shell of Allscripts EMR, but the documentation module came completely and entirely from Quippe.
We couldn't have any dictation. We wanted to get rid of dictation and transcription. We didn't want the physicians falling back to that.
The actual volume of it reduced by more than 99% with some stray notes here and there. And that translated to a significant savings of more than $1 million a year across 30 divisions, 200 plus physicians.
So now we can take all that data coming out of the note. The physician doesn't feel like they're filling in something for a research database later on, but they're actually just filling out their note in a very natural way, and then we get all this wonderful data.
In the 2.5 years that we have been live with Quippe, we have crossed the 500,000 mark of documents. About 94 to 95% of the documents are completed Monday through Friday, with about 5 to 7% being completed over the weekends. In the divisions that are already live on our analytics dashboard, they are doing even much better than the average. So their average is like 80% of the documents are completed by 5 p.m. in rheumatology on the date of service, with less than 1 or 2% over the weekend.
So our physicians come from all different areas, and oftentimes we're acquiring practices. So you have people coming in with experience of lots of different systems and lots of different ideas about how things can be done. And what was been nice with Quippe is kind of unified them in their love of a documentation system. This is something the doctors could pick up and use, and within just a few minutes be done with a note.
I see that possibility with Quippe. So I see every single click, every entry, every piece of information being squeezed. We want to squeeze that data to the maximum extent, and with that granular data we have the ability, and it is really funny. I mean, we have reached a stage where I'm in meetings and somebody says, but is this happening in just the rheumatology clinic, or which patients have not seen us, and are they all from a zip code in asthma? And many a times I can answer those questions in the meeting through dashboards and data. It takes us literally no time to bring in 3 or 4 quality measures or metrics or symptom signs or examination findings or tests, throw them into the template, and now the physicians are eager. Now they know that if they have to excel, they have to document, and once they document, they can see it. So really it has become a positive feedback cycle instead of a negative feedback cycle. To give you an example, if you want, saying what exactly are you capturing? Our physicians are capturing how many joints are inflamed. I think the national average is about 55% inactive disease at the last visit. As of half an hour ago, because the data is refreshed, I can say that 70% of our patients at their last visit had joints that were inactive or were quiet or not inflamed. So that is the kind of data that was completely impossible before we change the culture, change the templates, change the behavior. We will be reaching 100% documentation of activity. And because of that, we can measure with even a degree of confidence at a given time how are our patients doing.
But the other thing, we're very interested in genomics, and part of genomic research is figuring out how all these bits of clinical data come together and relate to your DNA or other genomic information. So with Quippe's ability to kind of categorize all those findings against the genomic database, it's given us a wonderful backdrop to begin that research. So our physicians in the community love it because they send patients here because of our specialty knowledge, and because that documentation is done so quickly, they're not waiting 3 or 4 days for dictation and then transcription to occur. That note is ready almost the exact same moment the visit is done, so the patient's getting constant feedback. Many of our physicians do the note in front of the patient with the patient, but the providers in the community where the patient may be going back to in a couple of days already has that note that evening.
The granular, structured, coded data in Quippe has given us the ability, but it has also exposed our physicians to something that they did not know that can happen. And even if you have heard it, seeing is believing, and living it from day to day. So they are now completely engaged, excited, eager to build, to see the dashboard, manage the patient, again look at the dashboard, and complete that cycle of rapid improvements. Was it easy to integrate? Yes, the integration has been seamless. We can get our vital signs, allergies, and meds, which are in our electronic medical record, right into Quippe without having to reduplicate that. And are we able to extract the data? Yes. Are we able to build dashboards? Yes. So almost on all fronts, if you look at those check boxes that we were planning initially to do, all those check boxes really, I must say that we were able to do that. And another metric is, did it drag for 5 years or 10 years? Did it take much more resources, much more time? And the answer to that is no. We did finish our project in budget, under budget, in time, with all the goals. So I would say that we met all those metrics. If you are doing documentation, and if you're not capturing granular data, and if you're not utilizing it and bringing it back rapidly, then you're just converting paper to electronic. And if you want to gain the benefits of healthcare IT and the promise, then you have to do it the right way. And the kind of structured, granular, coded data with a vast medicine engine that is constantly updated and that crosses vocabulary and lingo, that is the dream of provider documentation, I would say.
To me, success really is, the patients being treated better. And so at the end of the day, we are able to see more patients in our clinic because of Quippe. And that's the end of the day what makes a difference in a children's hospital. There are children who are now being cared for that couldn't. We have some clinics that have many months wait to get in the clinic, especially the specialty ones. So being able to see more patients, support the physicians better in their day-to-day work, it was really the number one benefit for us.